About 34 million people are estimated to be living with HIV in the world. Sub-Saharan Africa accounts for 69% of this figure. About 3.4 million people are estimated to be living with HIV in Nigeria in 2012. This is about 10% of the world's HIV burden, making her the country with the second heaviest burden on HIV in the world. Action Plus Up, AIDS Care and Treatment in Nigeria project is a US CDC PEPFAR funded project of the Institute of Human Virology Nigeria. The project provides the following HIV services: HIV testing and counseling, laboratory diagnosis and tracking of patient status, ART treatment for adults and children, including pregnant women, care and support for people living with HIV, people affected by HIV, and home-based care, prevention of mother-to-child transmission of HIV, support to orphaned and vulnerable children, strategic information monitoring and evaluation, including patient flow reports and progress, training and capacity building for healthcare workers, high-quality clinical care, and clinical and laboratory quality assurance and quality improvement services, as well as facility upgrade. Equitable Health Access Initiative is an indigenous non-governmental organization committed to positively impacting the human race through the implementation of highly innovative programs and projects that enhance positive, healthy, and productive living. This involves ensuring access to equitable, quality, and affordable healthcare services through the implementation of intervention programs in the control of communicable and non-communicable diseases. Equitable Health Access Initiative is a sub-grantee to the Institute of Human Virology Nigeria (IHVN) on the Action Plus Up project as lead IP in Ondo and Ekiti states.
Equitable Health Access Initiative (AI) is a leading partner in the state and is doing wonderful work with AI, a very responsive organization. When issues arise, they address those.
At the onset of the program, one of the most important things that actually happened was the stakeholder meeting. We had a stakeholder meeting where everybody, were called together: SACA, Ministry of Health, facilities, focal persons in facilities, Ministry of Planning, and the whole state in general. We were together and we were briefed on how the program is going to look like. So it's not a secret thing. Everybody now in the state knows there's an organization in the state that is doing certain things.
They came usually when we needed them first. Especially when we had those one treatment center applications. All the FLC, all the positive cases were found for a population of about 3.4 million. So, but since they come, we have more service development is now inaugurated, being activated. So it's been good in the sense that we can boast of about 35 places sites today, boast of about 24 reality sites.
In 2013, EHAI provided comprehensive HIV care and treatment services to Ondo and Ekiti states, implementing the Action Plus Up project in 48 healthcare facilities and 3 NGOs in both states. These facilities include tertiary, secondary, and primary healthcare facilities, making up 30 comprehensive service sites and 18 PMTCT standalone service sites.
Yeah, the kind of treatment has been, the lead partner has been AI, like I said, providing a lot of treatments as part of the ARV.
We provide prevention, care, and treatment services. So we have the pediatric ART, we have the adult ART, we have the PMTCT. And of course, we can't talk about services without counseling and testing. And of course, we have the ART pharmacy. All these are integral parts of the treatment program.
The patients are gaining a lot from this IHVN. Like materials they use to supply them, it helps most of our patients, especially the poor ones. Like at the end of the month, they normally give them something, food materials, apart from the drugs and other things they used to give them. So it's relieving a lot of hostel and sending them a lot.
EHAI supported several capacity building exercises for over 500 healthcare workers, including staff of government ministries, departments, and agencies in both states working on the project.
Apart from exchange of knowledge, most of our staff, either at SACA level, ministry level, hospitals management level, and facilities have been trained. So this issue of capacity development, I know not less than, if not close to 100 people must have been trained in the states in different areas: monitoring and evaluation, management, harmonized tools, and some other PMTCT, ART, pharmacy, all laboratory, all CADA have been trained. So the capacity development is actually very, very commendable.
Other achievements include upgrade and renovation of 21 of the supported healthcare facilities with supply of relevant furniture. 23 facilities were also provided with refrigerators for their pharmacies, while 38 pallets were supplied to 38 facilities. In ensuring effective laboratory services, the efficiency and protective management of equipment, 13 inverters and batteries were supplied to facilities. In addition, 6 point-of-care CD4 machines were supplied to remote sites with no CD4 machines to support baseline investigations for HIV-positive clients. We focus on the global vision of AIDS getting to zero. EHAI counseled and tested 1,405,637 general population, enrolled 12,112 positive clients into care, and tested and counseled 35,573 pregnant women under the PMTC program. Landmark achievements were made in the preventive care programs to most at-risk populations, MARPs, in which 35,573 persons were enrolled into the program, as well the enrollment of 2,613 children into care under the Vulnerable Children's VC program. A chat with the Care and Support Manager, the unit in charge of MARPs and VC programs, attributed this landmark success to the passion and dedication of the NGOs working in her unit. A key driver to the successes achieved by EHAI in the last year is the effectiveness of the community support services structure.
Community support structure is the continuum of care of clients, people living with HIV and AIDS, from the healthcare facility to the patient's home where they live in the community. It helps patients develop a coping mechanism for dealing with their HIV infection positively. The aim and the purpose of this community support structure activity is to ensure medication adherence in the community, and also to conduct home visits and carry out home-based care activities to ensure retention in care of our patients, and thus reducing the rate at which the rate of loss to follow-up.
This structure was set up to address the back-end process of HIV care, which takes place in the community and is made up of individuals who are mostly people living with HIV who have gained experience in positive living. They are treatment support specialists, TSS, for the adult and pediatric ART clients, network assistants for outreaches and TB HIV referrals and integration, mentor mothers for the PMTC program, and volunteers who conduct home visits. Their responsibility is to provide support to clients who have been diagnosed to be HIV positive through the various traumatic levels of their experiences, helping them to accept their status, enrollment into care, treatment adherence, and maintaining positive health and dignity in lifestyle.
Wọ́n dẹ̀ ti bímọ tán lọ́tọ́ bá bímọ yẹn àmọ́ pé wọ́n ti bímọ wọ́n á kọ́ wa pé àwọn ti bímọ àwa bá wọn àwọn ọmọ wọn àfún wọn lóhùn.
Ìgbà tán sọ̀rọ̀ nípa volunteer work yìí mo wò pé pẹ̀lú oògùn tó ń fún wa tàn lò ọ̀nà olùmí náà ṣe lè fi san oore yẹn nígbà tí mi sanwó pé I should render myself to assist others. So nísìn gan nìyẹn purpose nìyẹn tí mo fi sọ pé mo fẹ́ ṣe èmi gan mo ti agree láti ṣe kó tó di pé mo délé tí mo sọ fọ́kọ́ mi pé nǹkan báyìí báyìí pé mo dẹ̀ ro bí ṣe rí reason for that accept mo dàbẹ̀ so anytime tí bá ti fẹ́ ṣe lọ ṣe home visit disturb me so ẹlòmíì gan orí aago wọn àti pè mí ẹlòmíì ni gan ó lè rẹ̀ mí lára àwọn tán ní nọ́mbà mi náà nínú àwọn client wọn àti sọ fún mi náà mo strong ẹ má bínú ó yẹ kí tí wọ́n wò ní ara ìṣòro àwọn náà tún pè mí má ti báwo lára yín kan so àjọ àfúnra wa ni.
They also help with tracking of clients that miss their appointments or lost to follow up with a view to restoring them back into care and treatment. Home visits are also carried out while they help clinicians to track back to care defaulting patients.
There are 3 things we want to achieve. The first one is to test more people. The second one is to test more people. The third one is to test more people. Because if we could do those 3 in one thing, there will be more people on treatment, there will be more people prevented, and also there will be more people on care and support. So those are the things we are planning to do. All our work plan will focus towards that.
Well, we can actually achieve the goal of service saturation. Yesterday we still had a meeting, I had a talk with one of our top staff concerning PMC saturation, getting down to 8. We are aiming to go as far as 490 sites.
Also, we want more support to the facility. That we want to scale up. This year we're supposed to have started with private sectors, private hospitals, not doing it to sector. So we want that one to be implemented next year. Then we want to increase more facilities on EMTCT. Because if you are testing more people, those people have to be referred to some places if time comes.
In view of plans for the next COP year, EHAI, in collaboration with the state governments, assessed over 1,000 health facilities for scale-up and increased coverage in both states, especially on the PMTC program. We hope to strengthen collaboration between the organization and the state governments for ownership, increase coverage by extensive use of CBOs, as well as activation of more health facilities for increased accessibility to care.